Hello and welcome to this session. Learning Outcome, LO5, understand how to calculate medication dosages for oral, injection, and intravenous administration. Accurate dosage calculations are crucial in healthcare as errors can have serious consequences. In this session, we'll explore practical techniques to calculate safe and effective medication dosages. Calculating medication dosages ensures the right amount is administered. It's vital for oral, injection, and intravenous methods. Each requires careful attention to units and formulas. Always check the prescribed dose and medication strength. Verify the route of administration and units used. Oral dosages are often in tablets or liquids. To find the number of tablets, divide the prescribed dose by dose per tablet. For liquids, calculate volume required using concentration. For example, a prescribed dose of 500 milligrams with tablet strength of 250 milligrams requires 2 tablets. Liquid calculations follow a similar principle. Injected medications often come in vials. The formula is prescribed dose divided by stock dose times stock volume. For example, a 60 milligram dose with a stock of 120 milligrams in 2 milliliters needs 1 milliliter. Ensure the correct volume is drawn. This method applies to both bolus and continuous infusions. IV medications can be bolus or continuous. Bolus calculations resemble injection dosing. For example, a 200 milligram dose with 400 milligrams in 10 milliliters needs 5 milliliters. Infusion rates are prescribed over time. Calculate using total volume divided by time. IV infusions are prescribed as a rate over time. Use the formula, infusion rate equals total volume divided by time in hours. For example, 500 milliliters over 4 hours equals 125 milliliters per hour. Some doses depend on patient weight. Multiply prescribed amount per kilogram by weight. Mixing units can cause errors. Always convert units before calculating. Misreading medication concentration is another risk. Rounding too early leads to mistakes. Ensure results are clinically reasonable. Accurate calculations ensure safe administration. They reduce dosing errors. Confident math application supports patient safety. Effective treatment relies on precise dosages. This knowledge is essential for healthcare practice. Divide the daily dose by the number of doses. Use tablet or capsule strength to determine quantity per administration. Ensure the total matches the recommended daily dose. The process involves identifying the daily dose and frequency. Then, convert per dose amount into tablets or capsules. For an 800 milligram daily dose taken twice, calculate per dose. Divide 800 by 2 to get 400 milligrams. Convert to tablets using the tablet strength. For 400 milligrams per tablet, 1 tablet is needed. The patient takes 1 tablet twice daily. For a 900 milligram daily dose taken 3 times, calculate per dose. Divide 900 by 3 to get 300 milligrams. Convert to capsules using capsule strength. For 300 milligrams per capsule, 1 capsule is needed. The patient takes 1 capsule 3 times daily. For a 1,500 milligram daily dose taken 3 times, calculate per dose. Divide 1,500 by 3 to get 500 milligrams. Convert to tablets using a 250 milligram strength. 2 tablets are needed per dose. The patient takes 2 tablets 3 times daily. Ensure total doses match the recommended daily dose. Tablet or capsule strength should match the calculated dose. Doses must be evenly spaced. Units must be consistent. Instructions should be clear and unambiguous. Correct calculations ensure patients receive the right daily amount. Avoid underdosing or overdosing. Clear instructions support safe administration. Consistent treatment relies on accurate dosages. This routine calculation is critical for oral medication safety. Divide the daily dose by the number of injections. Use the medication concentration to calculate volume per injection. Ensure the total matches the recommended daily dose. Follow a step-by-step calculation process. Verify that units match before finalizing. For a 1,000 mg daily dose taken twice, calculate per injection. Divide 1,000 by 2 to get 500 mg. Calculate volume using concentration. For 500 mg in 2 milliliters, 2 milliliters are needed. The patient receives 2 milliliters per injection, twice daily. For a 900 mg daily dose taken 3 times, calculate per injection. Divide 900 by 3 to get 300 mg. Calculate volume using concentration. For 300 mg in 1 milliliter, 1 milliliter is needed. The patient receives 1 milliliter per injection, 3 times daily. For a 0.6 gram daily dose taken 3 times, convert to milligrams. 0.6 grams equals 600 milligrams. Divide 600 by 3 to get 200 milligrams per injection. Calculate volume using concentration. For 200 milligrams in 1 milliliter, 1 milliliter is needed. Ensure total injections equal the recommended daily dose. Convert units correctly before calculating. Check that volume is realistic for injection. Clearly state the final dose in milliliters per injection. Accurate calculations support safe clinical practice. IV infusion rate is how fast fluid runs into the patient. It's expressed as milliliters per hour or drops per minute. Calculating the rate correctly is crucial. Check units and ensure the rate matches the prescription. Equipment used must align with the calculated rate. Correct. The core formula is rate equals total volume divided by time. For example, 1,000 milliliters over 8 hours equals 125 milliliters per hour. Convert time to hours if needed. For drops per minute, use volume times drop factor divided by time. Rounding is necessary for practical application. In conclusion, accurate dosage calculations are vital for safe medication administration. They help prevent errors and ensure effective treatment, supporting patient safety in healthcare settings. If you have any questions, please don't hesitate to reach out on WhatsApp at 07484361688. We look forward to seeing you again at the next session. Thank you.